thank you for joining us here today. It's, first of all, a very interesting and unique panel that we've put together, and we're looking forward to have very diverse narratives and insights from each one of you. Firstly, I just want to hear in brief your thoughts on what I just spoke about, and probably take that as a starting point to the whole discussion. MK, sir, can we start with you?
The first thing, about Indian cinema representations is it's not mimetic. I mean, if you understand what I mean, it is not based so much on observation as much as it's theory down in some sense. Every movie has a message of some sort, right? Which doesn't quite correspond to reality. Like for example, the world is very complex, right? We can't really fully understand the world, right? So the question is everything you speculate about. So when you talk about, for example, something like mental health, you talk about that. Diagnosis is speculation, right? It's extremely speculative. Whereas there is a certain thing in Indians that, that you just have to label it, right? You have to label a certain ailment of some sort. And you say once you label it, automatically, like American movies, sometimes they do this, that you get to the hospital, you're safe, right? No, when you get to the hospital, your troubles are beginning, right? Okay, from experience, okay? So my point is that this being the case, this entire thing of uncertainty that this has to be speculated about, it's as if, you say, bipolar disorder, okay? If you say that, it's as if, there's a certain classical symptoms of bipolar disorder that everybody fits into that. That's a basic thing, they go about it, right? Whereas I think, that sense of, based on observation, I don't think that there's too much experience involved in the way, these people portray it. It seems to be based on theory of some sort. They go into some, a textbook or some such thing. What are the classical symptoms? They portray it like that. So finally, what happens is that when you actually make the movie, you finally are reduced to, is it a good performance, bad performance, good presentation, bad presentation of a known condition, right? Whereas we know that if you take schizophrenia, if you take schizophrenia or something like that, every case is its own, okay? There's no that kind of thing. It takes a lot of effort to diagnose it in some way and give some kind of treatment. So it's this, there's a fundamental problem with Indian cinema that everything is known already, okay? It comes from this sense of, what do you say, that everything, the Vedas contain everything, right? If it contains everything. So finally Marxists will make movies about that the working class unity, which is a complete fiction, right? So the question is it's the same thing here when you deal with the mental issues. It's the same sort of oversimplification, what you call reductionist, to some known and labeled condition. That is my feeling about it.
All right. Apurva, would you want to take over?
So considering the progress that we've made over the last few decades, I'm kind of happy about the change that we're seeing in portrayal of mental health issues on screen and characters being more vulnerable, especially male protagonists being vulnerable. That being said, I feel that things like the kind of abuse sometimes that we see on screen, sexual abuse, physical abuse, when it comes from a place of glorifying it, that's something that doesn't really sit right with me. And I know this is not what this discussion is about, but a lot of times characters who are abusive to another character maybe, they would have a past, they would have a backstory. Sometimes it would try to justify whatever they're doing. All I'm saying is there's a difference between portrayal and glorification. I wish we could see some sort of consequence to abuse on screen, that because end of the day, the people watching our films and see some sort of consequence to abuse really matter, right? It's, of course, the story, the art that we're trying to make is definitely important. But before that, we need to put people above any of that. We need to sort of make sure that no one is leaving a film set or a film theater a feeling of being unsafe or a feeling of being, not represented well on screen. So I think that's pretty much it.
So this is good because I kind of lie in the middle of both of what they said. So I do agree that it is reductionist. I do think that the portrayal, even through the years, right, has been very surface level, it's like making a Batman movie and just Googling Batman and checking the first 4 comic books, right? It's essentially that. They read the first 3 reports on Google and, they think they know everything about the illness or the disorder or the issue that someone's facing. And it is very complex. It's very gray. My depression is not the same as your depression. And I do feel like there has been evolution, which is very clear, right, from the 1980s till now. But I do think it's very performative evolution. I feel like because now more people through social media and through advocacy of this, space has been there, I do think that films are trying to jump on the bandwagon, for lack of a better term, right? I don't think that there is a there are some films that do it well, but overall I feel like when it's ad hoc into a film, I don't feel like there is any kind of sense of trying to lay out for audiences who don't know that particular disorder or illness or suffering that someone's going through, and then lead to tangible steps or tangible ways that they can kind of adapt with the thing you're facing, right? Because it's not something that can get fixed. It is a prolonged kind of movement within yourself. It's a part of growth. It is years of therapy. It is unlearnings. It is learning how to take support and draw boundaries with aspects of whatever you're facing. So I do think that films have kind of jumped on that space and it looks very nice, but I do feel like aspects of it are very performative. Like I said, there are literally one or two that come to my mind that, kind of...
Actually, interestingly, let's go deeper into that. That was going to be my next question. Could you share a film or series who's from Indian cinema or from really around the world, which portrayed mental health in a way that resonated with you? And if it did, then how did it affect your perspective around mental health?
I think one of the best representations of mental health is a series on Netflix called BoJack Horseman. I think it's like, I don't know how strongly I related to a cartoon horse just going through so many things that I have felt and never seen portrayed anywhere else in any cinema. So I think it is a very dark series, so it does touch upon a lot of like issues and kind of dark themes. But if you've ever that is the closest I will ever get to representation on screen for some of the aspects of depression, anxiety, self-sabotage, and stuff like that. But I think in Indian cinema, there's a Malayali film. I'm going to butcher the name if I say it, but it's with Fahad Fasil. There's
Kumbalangi Nights?
Kumbalangi Nights. I think that I do think the intent for portrayal was good. I think that the bipolar, the portrayal of bipolar disorder, and of course, like Sir said, it is the performance of the actor and the way it's directed, choreographed and stuff. I do feel like there was some intent to try and do a good job, and I think, of course, Fahad Fasil is a very good actor. I think he did a very, very good job. That scene, and of course, Amir Khan, that scene itself it felt like it was done with care. It felt like it was done not to dramatize it. I won't say there aren't many flaws with the movie. There are some, but I do think that scene in particular has made people, kind of feel a little more heard within that space. And I don't think that Dear Zindagi is a very accurate portrayal of therapist and patient relationship, because it's not.
Yeah, we have very romantic Shah Rukh being portrayed.
He's a Shah Rukh Khan. I don't know what to say. What else to say? But I do think that I've heard a lot of people say just by watching that film that they are open to going to therapy. They are open to, because that's Bollywood. Like it's so ingrained in our culture to drive everything that we do, that just seeing it as such a loose representation of therapy, people have decided that, okay, maybe therapy is not that bad, and I mean, we'll take it. It's fine.
So what are your thoughts on this?
Name films?
Yeah.
I mean, as far as international cinema, there's a film called Dead Ringers. I don't know if anyone has seen this movie called Dead Ringers. It's about twin gynecologists who are in the same profession, like Jeremy Irons, and they pretend to be one person with an actress, and one of them falls in love with the actress. So what happens is that these people who are some kind of, they're so close to each other that their personalities are contaminated by each other's. Okay, I mean, this is not a diagnosed condition, but I'm saying it's actually a horror movie. But you can understand this thing of a personality being corrupted and contaminated by another. So I remember one line from this film. What is this? You're going into unknown territory. One brother tells the other, you haven't had any experience that I haven't had beforehand. Okay, so it's sensational. I mean, it's a horror film done by David Cronenberg, Canadian. I mean, I would say, but I don't know exactly what the diagnosis. There's no such thing. As far as Indian movies are concerned, there's this movie again, not Arvind and Spoke a Whale. I don't know if you've heard of it. It's just about this kind of poetic thing of this man in some kind of depression, some kind of schizophrenic thing. There's no effort to turn it into some kind of case. It's not a case in that sense. They just take this man, they just focus on him, the kind of situation. But I think, one of the fundamental requirements that we need, in cinema is not to understand the case as much as sympathize, right? We can't understand it really, right? You have to understand, you have to understand that the condition is a human condition, that anybody can get into this. That gives you sympathy of some sort, and you realize you have to deal with it in such a way as to sort of minimize the pain. Because you can't, the actual getting that person out of that condition would be a difficult thing. So the thing of, understand that this is a human thing, that people can go into this, convey that deep sympathy, that kind of thing, It could also be a mystical condition, for instance, okay? Even a mystical condition could be taken as a psychiatric condition, right? And the borderline may not be so much, so clear as all that.
Is it more along the lines of, wanting to be seen on screen rather than coming to a definitive conclusion of what a person may or may not be going through?
Yes, that's it. Okay, exactly. Because we don't need to know exactly what that is. We are not in a position to sort of, But the point is, make it comfortable, make the thing, and understand that this person is human like you, whatever he may be doing, right? He's not able to. That we have to do. We have to deal with that. And one more thing. I saw this movie on Alzheimer's called Astu, I think. It's I don't know, it's so clean, right? Alzheimer's is messy, right? Okay. People can't deal with it, okay. This whole thing is sort of, sanitized in some way, and you get an actor to play that role. The actor is not going to appear in uncomfortable situations, okay. He's a big actor, okay. Mohan Agashe. So the whole thing is, that he may, whatever he may do, or histrionics he may do, he is not going to be shown defecating, for instance. He's not going to be shown. He's not going to allow that. So what happens is that whole thing is sanitized in some way. I would call it Brahminical, this whole thing, eating out of clean plates, living actually well-dressed, always neatly shaved, okay. There's a certain sanitization of the condition. That's a thing.
Yeah. Apurva, would you want to share?
Sure. I've watched a couple of things lately that I would like to talk about. Especially indie cinema, independent films in India have been doing a decent job at representing mental health conditions well. That being said, there's a Punjabi film called Jaggi. It's set in rural Punjab, and it's about a boy who discovers that he's suffering from erectile dysfunction. But this being rural Punjab, it's not normal for him to talk about. But the moment he finds some courage, he gathers some courage to talk about it to a friend. He's abused and tortured over the years. There's no one for him to talk to. So this is probably a lot of trauma that he's gone through over the years. And we're not even probably focusing on it while watching the film, because the subject of the film is Jaggi's erectile dysfunction, right? So the kind of trauma that the actor has portrayed, the kind of writing that Anmol Sidhu is the writer-director of the film, the kind of writing that has gone into it, it just shows that there's been a lot of research about the kind of impact that a condition like this, abuse like this would have on a young boy growing up in rural Punjab. So that's, I think, one of the films that really moved me. Also, there's an Iranian film called The Salesman. where this woman goes through abuse again, and it somehow becomes about the husband's fight for revenge or justice. It's never really about her own fight. So but I do like the portrayal. I'm an Asghar Farhadi fan. I would say that I really like how the male protagonist, the husband, has been. We see him in a cab with the lady being uncomfortable around him, and him justifying how it's okay that she's accusing him of being a potential threat to her. He's okay with that, but when it comes to his own wife, he's not able to accept that it's not really her fault. So I think that's one.
Now, in your opinions, do you think Bollywood has traditionally contributed more to the stigma surrounding mental health, or over the years has it enabled conversations at home and played a significant role in breaking down some misconceptions, if not all?
Difficult to say. I don't know. I think some households, I don't know. I don't think it has much of an effect. Actually, this is my sense. I don't think it would have. I don't think people would take. See, one of the things is when a person like Shah Rukh Khan plays a patient of. You're always looking at him as Shah Rukh Khan, right? So the question is, the thing goes into that this make-believe goes into performance, it goes into assessment of that. It won't go into an understanding of the situation. I don't think it leads to discussions about the situation at all. This is my sense of it, right?
Andre mentioned, a lot of youngsters, when they watch films like Dear Zindagi, if especially they're coming from spaces where they're not familiarized with therapy or they're not open about it, it has often led to those conversations, at least between friends, or probably prompting them at home. Do you feel that may have a significant impact in them taking that step finally, or do you feel like that might not be a result of Bollywood contributing to the discourse?
It may have happened, but I don't think it will be a dominant response. It won't be a dominant response.
Yeah, I also think it's quite an outlier. I think that it's that film specifically. The whole plot was about, Alia Bhatt experiencing anxiety and, social depression where she couldn't understand aspects of herself. And I think the therapy plot was decent in it. It was not very out of place and stuff. But I do think that, mental health is a very broad term, I feel. I do think that Bollywood has a very negative effect when it comes to, how do I explain this? Results of generational trauma, right? So, for instance, toxic masculinity, for aspects of anger management, for aspects of patriarchal thinking and stuff like that. Because these are all results of generational trauma, childhood baggage, and then development of aspects of depression, anxiety, OCD. Some of these conditions develop because of nurture, right? Essentially. And I think that Bollywood has a strong track record of, as Apurva said, glorifying the resultants of these things as this has happened. And a very simple case of Animal, right? The film very clearly, the director said it's not unknown. It has glorified misogyny and violence and those aspects. But the film itself does a very, you hear the musical notes of triumph every time there's violence, when there's abuse.
Do you believe that the character is going through some sort of mental health issue to be the way that person is?
Very possibly. Very possibly. I do think that we often see the aftermath of things that have happened previously, and no intervention or no recognition or no unlearning came in between those two halves, right? So I do think that I don't want to say Indian cinema also. I feel like it's strongly Bollywood, although there are some aspects of some of the regional places as well as Hollywood that does this. But I do think we have a strong track record of basically glorifying these aspects. And like I said, you watch a movie, you relate to it, you see your favorite actor being misogynistic on screen, you have certain anxiety, you have certain feelings, and then you suppress those and then play out a lot of those actions, thinking that's the right thing to do, kyunki hero to kar rahe to.
Apurva, would you want to add something to that?
No, like I said earlier, I feel that the people watching the film for me and the people involved in making films are very, very important. And the discussions that happen at home, I might not be the best person to talk about it because somehow all of us are involved in making films, making shows, making cinema. I wouldn't know what people who are not involved in filmmaking take away from these things. All we can do is research well, talk to enough people, talk to enough professionals when we're writing our scripts, when we're we can always get them doctored, we can always get them have screenings for professionals who might know, who obviously know better than us. So I feel it kind of protects people involved in the films and the audience as well. So I think that will really bring about a change. Having conversations, discussions, and reading up as much as we can would probably help with a better portrayal of mental health on screen.
And with Indian content now going through a significant shift where people are moving away from the theaters and going all towards OTT, how do you think these portrayals affect the viewers consuming content at home, especially the younger generation which is predominantly consuming it, on their perceptions of mental health? Can our content right now, there have been series like Class that has come by or many others online, can our content today serve as some sort of an early education on this topic which then prompts them to go learn more?
Sorry, should I? Yeah, I think so. I think that the Made in Heaven example you gave was very good. I think that I feel like most people want to see themselves on screen, and I feel like Indian cinema has very starkly focused on very clear archetypes, and not through the gender spectrum or not through the, kind of neurodivergent range or any of those, anything that does not look like what is Bollywood perceived to be normal, right? And I think that OTT is the way to do it. I think that because they have a little more freedom, they have a little more on the ground players, and I mean they're just younger people doing it half the time. So I think that it leads to a lot more discussions. It leads to a lot more this thing, and you can correct me if I'm wrong, but a lot of the writers' rooms I've been in, if it's for a larger scale project, it's pretty complacent. Everyone's like, "Haan, theek hai. Whatever that guy said, we'll do." But I have been there for when we're making a 5-minute video, and 5 people have very strong opinions about this does not sit right with me. So I think that mentality of, hey, if we are representing this identity on screen, we need to safeguard it. We need to be very true to it. We need to actually know what's happening with that identity. It's coming from younger people, and it's slowly driving up. And I do think that OTT is the space that could see the boom of a lot of these projects, being more accurate and better in that sense.
Can I say something? I don't know how it's connected. See, one of the things, this division between mental health, right? Division between okay and not okay doesn't really exist in real life, right? So, for example, all of us are in some way or the other incapable of making certain decisions, certain things, right? All of us, right? And one of the fundamental problems with, say, mental health issues is communication, right? Can't communicate would be a fundamental thing. Now, I find in your everyday life, we can't communicate. All of us, we find problems with communication. I'll give you an example how it's represented in movies. For example, if in American movies, if A says, I love you, and B says, I love you too, there is no doubt in the minds of either of them that they mean exactly the same thing by the word love, right? But if you actually look at it, it doesn't mean anything, okay? So what happens in movies is that there's complete communication, complete communication, okay, based on a certain thing, whereas in everyday life, we find that communication is absent altogether, okay? I mean, if you want to talk to people, you have to actually go around searching for people to talk to in the world today, right? It's not that easy that you meet somebody and you talk to him. There are 15 minutes conversation you can have with someone that person will make complete sense to you, will make complete sense to that person. What happens is this fake sense of complete communication that you find in, in Bollywood movies, right? Hollywood also in many ways, okay? Except for certain directors, the sense of complete communication is there. It doesn't exist in real life. So what happens is when that presents that thing, that this communication is actually a problem in everyday life. Unless that point is made, what happens is that it creates a sense of the world as completely well knit together. It's not knit at all, right? The world is not knit, okay? So it communicates that sense that the world is so well knit that, I mean, I'm talking about everyday life, I'm talking about family life, I'm talking about children, I'm talking about parents. It's not possible to communicate at all, okay? It's very, very difficult to make sense in, whatever you want to say. But cinema cinema presents everything as an ordered world. So the question is that if it's sort of, the normalcy depicted in cinema, I find completely fake in some sense. It creates a certain sense which actual life belies, and that may cause you problems. Like if you have to look at unless it's portrayed properly in some sense, okay, then maybe they'll be able to deal with this thing of lack of communication. I think fundamentally this mental health is only a matter of degree, and it has to do with communication of some sort. This is my sense of it.
And do you believe that there are barriers to that communication at homes, because we all come from a space of not having enough awareness towards mental health, and the same just continues? And when you see that on screen, having a sort of a more completed communication, like you mentioned, that gives a little more comfort when you're viewing it?
I'm not sure about that, because I'll tell you what would happen probably outside when you watch the movie is when you find reality not look, why are we doing this thing of texting, right? Because the texting somehow reduces the actual level of communication to a very minimal thing, right? I got for example, some unknown person sent me, good morning, coffee haita, okay, good evening, UNING, coffee haita. This is the communication. Now no, it was somebody who thought my number was the number he was looking for, but the point is I realized the communication is like this. Have you had coffee? Coffee haita in Kannada would be, have you had coffee? Okay. So I'm saying it's reduced to this texting, reduces the, shall we say, the range in which communication takes place. Okay. So what happens is gradually it's coming down, and people are not talking to each other. Okay. This thing of communication was not such a problem in the 70s and 80s. It's become more and more of a problem now. And I think what happens is that movies give the impression that communication is possible. Actually, it's not possible. It's getting worse and worse and worse. And the telling of stories, sharing of experiences, what do you say, communication of some sort, and admissions, okay, all these things. They've become very difficult, and film gives the impression that it's all well knit together. The world is well knit.
That's a very interesting. Yeah.
So I disagree slightly. I do think that communication has changed its form. I think that Indians generally as a people are very non-communicative. I feel like we don't talk about anything. Everything is like at the dinner table. Oh, this happened. Okay, fine. You'll fix it. Okay, okay. So I think that. But I do find a lot of sense of community. While I don't talk to my friends as much, they know everything that's happening in my life. Like we send memes all the time, we send reels all the time, and more often than not, I'm able to communicate how my day is going mentally through a meme, which I would not even attempt to do that through speech. But it works. I think that. So if I send my best friend a meme of me saying that, oh, I'm having a meltdown or whatever, she has the ability to gauge whether I'm just saying I'm having a bad day at work or I'm genuinely having a bad mental health day. And she will call me and ask me, do you want advice or do you want support? So I think that level of communication, I think it's changed its form. But I do think it's better. I think that it's better that we're communicating in some way, shape or form, as opposed to just kind of grinding our teeth and then going through the day while not talking about things. I've had many communications with my dad recently over the last couple of years about therapy and about the growth that I've had in therapy. I don't think he would have been as stoked to hear about it 5 or 10 years ago, right? So I think that I think that there has been like movement.
Have OCD. Those kind of conversations have started to scare me a little bit because these are the things that we rely on professionals for. But unfortunately, Instagram is doing it for a lot of people. So I think that's just the bit that scares me.
I think interesting. I mean, like I said, we can open this up to the audience at the end of the panel, where we can see how completed communication versus reality of communication affects youngsters when they're watching it. And also, interestingly, this therapy talk and the way it's being misused is something that has been happening for a while, especially in sitcoms. I think most of us are acquainted with Friends, and Monica's character of supposedly having OCD and her obsession with cleanliness has always been portrayed as some sort of a problem in her life. And anyway, moving on from that, we will come back to it at the end of the panel. Apart from films like Dear Zindagi and Kala, we can leave those aside. Do you think we're seeing a shift towards more nuanced and empathetic portrayals of women's mental health? And how are we doing the same for male characters on screen? Are we feeling like there is a bit of a balance between them, or are we still moving towards regressive stereotypes like toxic masculinity and portrayals of that on screen?
I don't know. This toxic masculinity is a problem, it's a serious problem. But one thing I'll tell you, when we're discussing movies, right, we are discussing on middle class issues or upper class issues, right? There is also a working class. There are people, illiterate people, and now we're not discussing that at all. No, the question is, what kind of communication do they do? They don't get into internet. They don't get into even the telephone. I don't know exactly what the conversation is. I've got a person who's working for me, right? He gets drunk. And he's always threatening murder when he gets drunk. And I've begun to feel that murder is a form of communication, right? Okay, because, I'll tell you what. He says, if you say, I'm going to teach him a lesson, and you threaten to murder him, how is he going to learn if he's going to be murdered, right? So the question is, obviously, there is something here going on. I mean, that class, it's not represented in Bollywood at all.
Yeah,
it's not represented at all. The question is, when you talk about mental health, you have to deal with that class also, right? Okay.
Absolutely.
Okay, so when you do that, how are you going to reach that class at all? It's not that there is great communication between them. This man who's working for me and his wife who's also working for me haven't spoken for God knows how long. They communicate through me, okay? So the question is, that being the case, how do we reach that group at all? How do they respond to each other? How do they talk to each other?
I don't know. I think that there are some films that treat male protagonists differently than before. I do think that more female-led films, which is a fantastic thing, are happening. But again, I just feel like it's performative. I feel like people want more this thing. It's just like a loop. It's good that it's happening, but I don't think like the substance behind it, the intention behind it is to make a great film. And it just happens to be a female-led film, right? I think the intention behind it is like, this year we should make some female-led film because people are talking about it. So.
And you do feel like online discourse is far better in discussing mental health than cinema can ever touch?
1000%.
Yeah.
I think that online discourse, I do think that what Apurva said is a problem. I do think that there's over advice in some scenarios. But I honestly think let's take a space like Instagram, right? I think therapists are now countering that space, right? They are influencers now. There are therapists online who literally break down, and I love the fact that they break down not just depression and anxiety and things that we have now come to understand as terms under mental health, right? But they also break down avoidance and smaller aspects of it, hyperactive anxiety or high functioning anxiety. There are such, like Sir mentioned, there are such nuances to every condition that it's not a be all fits all, right? So I think that in certain circles, it is a great leap forward where all of these discussions happen, because I just see a tweet and I'm like, that's me. I didn't know anyone could ever say that.
All right. This is sort of our last question before we go to the audience. So we spoke a lot about how we do feel like cinema may just give a little bit of a prompt, but it may not actually have the kind of impact we imagine it to be. Looking forward, what kind of changes or improvements do you think can be made in cinema to better the portrayal of mental health on screen? And are there any particular mental health issues that you feel has been severely underexplored that we should focus more upon?
I'd like to share a little story. I hope that sort of explains what I'm trying to say. Also answers the previous question. First of all, like I already said, a lot of research is required, a lot of conversation is required. Fortunately, we have a lot of mental health professionals in India. I think writers, filmmakers, producers can always, rely on them for at least some kind of accuracy. That being said, about the portrayal of male protagonists and male characters and female characters, I do think that there's been a change because for someone who's been working as an actor for a while, very, very recently, I was fortunate enough to work with an acting coach who's also a writer-director. And in a class of 30 people, she told the men to operate from a place of sadness. This is a Navras class. Men were asked to operate from a place of sadness, and women, on the other hand, were asked to operate from a place of anger for the same scene, for the same monologue. We were asked to explore these emotions, and I feel that it's great. Like you said, real versus real. Real, maybe it's very important that we as women sort of explore our anger, feel okay to express it, feel safe enough to be able to react when we want to react. While on the other hand, men should be able to, cry it out, be vulnerable, not feel like they're inadequate if they end up, breaking down. So I feel like if a writer-director who's actively working in theatre and films, also training young actors, I feel we're at a decent place. If they're functioning like this, I think we're moving towards a better place in Indian film industry, at least.
Andre?
I mean, I agree with a lot of the points she said, right? Which is essentially like to do your research, you can talk to people who are comfortable sharing their stories within the scope of what you're trying to do. I do think that sensitivity training and like more exposure to the everyday functioning of a person suffering from whatever you're trying to portray on screen is like super necessary. Because I do think that we see like these highly dramatized, like high stakes life or death situations of sorts when we're talking about various mental health conditions. But it's usually the day-to-day that really like grinds it out of you. It's usually like, what do I order for lunch? That creates like a pit of anxiety. Oh, are those people talking about me? Or like whatever. These are my personal experiences where like, it's the smaller things that kind of break you down, that lead into the decision paralysis for some of the bigger things, right? And I do think that one thing that has to get better in all cinema, not necessarily Indian, is the portrayal of therapy and supportive functions within the mental health space as being there not only when you have a problem. I think that it should be there as the same way that you would diet and exercise to stay and maintain health, rather than, oh, I need to lose weight for the next wedding or like the next function or something like that. And I honestly don't know many places that do that really well. There's a really good show that's come out on Apple TV called Shrinking, which I urge you guys to check out. It's very, very beautifully done. It's with Jason Segel from How I Met Your Mother. I think he's one of the producers, writers also. It's essentially about a therapist who has just lost his wife, and it showcases the grief he's going through while also having to manage his patients and advise them on their issues and their grief and their problems. It's a really beautiful breakdown of the human psyche and like what and how he learns and unlearns and then fails and then rises up again. It shows the graph really well. So I think that's a great show. Season 2 is coming out. I have no affiliation with Apple TV. I'm just saying it's a good show.
I think the victims of social injustice should be presented as people with interiors, not simply as victims of society, but that they have interiors, that they can reflect, that they can think, okay, at whatever level. I think that this we've not done at all, that victims of social justice that actually have interiors, right? We always see of them, I mean, this is also representation of women, for instance. Like, for example, have you seen this big hit movie called Great Indian Kitchen? I mean, that woman, I mean, it's a big hit, this movie, but couldn't she do something in retaliation? Couldn't she plot revenge in some sort? I mean, especially when people have so many strictures, I want this, I want this, I want this, I want this, and you go on attending to them, at some particular point you show that you're not going to get what you want. Not say it so many words. Okay. For example, you insist on cleanliness, dirtying something, it's rebellion, right? Okay. Okay. I mean, that woman is so helpless, and it's as if, victims of social injustice would be all sorts: class, caste, okay, gender, okay, ethnicity, all of them would be victims of social injustice. I think they should be shown as people who are capable of taking decisions, not simply capable of taking decisions based on their psychologies, based on what they want, right? That, for example, when is a Dalit in Indian cinema ever presented as a person with an interior, right? Never, okay. It's the same thing. Now you have this, religious minority. Minority has no capacity to think, has no capacity to reason, has no capacity to have personal qualities, So that fundamental thing that you have victims, those victims must also have the capacity to think, have the capacity to reflect, have the capacity to have their own, make choices. And two victims need not necessarily make the same choice, right? That's what I mean.
Yeah, I think the key takeaways here so far are, of course, the first more visible change would be to have like a lot more experts coming on when we are preparing and writing for the content, have more research folks, have more psychiatrists, psychologists consulting on those scripts, which does happen, by the way, in very small pockets of filmmaking right now with people who have more, I would say, resources at their disposal. They are taking up these steps, but it's still very, very less, which leads to most of the content not really matching the levels that we'd like it to. So first step is, of course, that. And second is, intersection is at the, it has to be at the foundation of everything, including mental health. Like you mentioned, class is not depicted properly in Indian cinema, neither is caste, and most of our characters are Brahminical by nature. They are also mostly men, and we do definitely need some change over there to understand the lived realities of people much more closely rather than having like a fake or a make-believe situation that people take away from. Any other points before we open it up to the audience?
Thank you for the wonderful interaction. So, my question is, there's a lot of depiction, there's a censor board for movies in Indian cinema, in theatres. And recently, after the COVID, on OTT platforms, there's, I don't think there's censorship. So what the censor body effectively does for the big screens is not effectively controlled, or the content is freely available on substance depending on alcohol abuse or drug abuse. So I think this is very concerning for the younger generation. As it is in our generations, we were not privy to a lot of this kind of content, which gave us a better mental health by default, just by being there in our times. But these days, there's a lot of consumption, Okay, for example, in a family setting, the parents are watching this, and immediately, there was a series that I watched where everything is normalized. I think the web series where Sushmita Sen acts as Arya. So if she's feeling low, she immediately comes and the directors also just copy pasting all the Western elements into our Indian cultural context. So she comes and immediately
excuse me, ma'am.
Yeah.
Just in the interest of time, because we have 5 minutes.
Yeah, sure. I'll just finish it quickly. So she pours alcohol into whatever whiskey glass, has it neat raw, and many short of rolling a joint, everything is depicted on OTT. This is really concerning. So where is and this influences the younger generation a lot.
Yeah, great, thanks.
Yeah.
We'll keep that question. We'll take maybe one more question and then respond together. Sure. We request you to keep it short and keep it to a question and not elaborate.
Yeah, my question to Apurva and to the panel. Just like today we have safety in mind during the filming, like stunts or intimacy coordinator. I think it requires also mental subject matter expert, so that a lot of suicides in celebrities also can be avoided, like Sushant Singh Rajput or last year the production designer Nitin Desai, other thing. Thank you.
Yeah, maybe take the questions and we'll take
Apurva,
one.
I think it was.
Yes, sir, I absolutely agree with you. If at all I get to be at a place in life where I get to make my own films and I get to take a call on who is involved in the crew, I would definitely have a mental health professional, not just for the research for my script, but also for the well-being of the cast and crew, because it's very, very important. I've been taught that people are above art. Art is very, very precious, very special, but people are always above that. So I think and I hope that we can always, work towards getting to that point.
Can we take that question? Do either of you want to answer what ma'am was asking about?
So there is a censorboard aspects to OTT. It is a lighter framework in the sense that the ratings that go for film in theaters, whatever your R rating and what is it, A and U and whatever, right? So there are grids by which they are placed. But on OTT also there are guidelines and there are bills that are being talked about to further kind of chokehold OTT. I do think it's fine. I understand your concern in the sense of it influencing younger generations and people watching it, right? With OTT, it is your right and your choice to click. And most OTT platforms, before you click on something, it tells you immediately, hey, this show contains, sexual content, alcohol, drugs, violence, whatever it is, right? And most OTTs allow you to parental control. Theaters don't allow you to do that, right? What is to stop your kids from going and watching anything? And I do feel like, yes, there is a lot of Western influence, if we can call it that. But, I mean, most of us are wearing Western clothes, we're speaking English, where there's a lot of Western influence that has permeated we're a colonized country. So I do think that a lot of what's being shown in OTT is not very far off from what most of us are doing at home anyway. Everyone's drinking, everyone's smoking, everyone's partaking in activities that might have seemed lewd and like unseemly like years ago. But yes, there are some that take it to a very, very high extent. And they honestly get called out for it. Gratuitous violence, unrequired sex scenes, abuse that's glorified. I mean, if you look at Twitter, you will find threads on almost every film or TV show that's been made about that.
Hi, my name is Anushka. I lead science communications at a research center, the Center for Brain and Mind at NIMHANS, and we focus on researching severe mental illness. So a lot of my job is to design outreach and communication to tell people, educate people about mental illnesses. So one of the most common misportrayals or like poor portrayals of mental illness is that several people with severe mental illness are termed as violent or unstable. They're called pagal, crazy, you shouldn't talk to them, you shouldn't be with them. The more common portrayals are of common mental illnesses like depression, anxiety, and stress. And that's what LGBTQI issues, they are very common. But people with severe mental illnesses like bipolar disorder, schizophrenia, dementia, they're not portrayed or not portrayed well. So as someone who is at the cusp of both science and as a very avid film enthusiast, Bollywood buff, I wanted to know how you think we, like people like you and I, could foster collaborations to make sure that portrayal of mental illness is more widespread, not just through cinema, but through social media, through print media. How do you think we can work together to make sure that these portrayals are put out, they reach wider audiences? As Sir said, they also reach people, marginalized communities or working class communities who often don't get to see themselves represented. How do you think we can do this?
So if you could answer also from your understanding of Marathi films, because you have looked beyond Hindi cinema, right? There are English, or you've also spoken about European films. Do you want to kind of touch upon that a bit?
It's very difficult to say. I mean, how exactly. See, one of the things is we can't, there must be people who are looking at things, they must have read a lot of stuff, okay? And gradually the level of literacy in society is coming down, if anything at all. It's getting more and more, I mean, that's the sense I'm getting. That the kind of reading, for example, you have to be in literature before you start making cinema, right? You must have read literature, and I don't mean, contemporary literature. I mean, there's huge amount of literature which, the past, which nobody reads. Film critics don't see cinema at all, okay? They're not aware of what has been done in cinema, right? They only see the latest movies, as if that all knowledge is the latest, that nothing has happened in the past. It's very difficult to say. I mean, have a collaboration. You'll have a collaboration of the same sort. How are you going to really, how are you going to improve the content? There is a definitely depletion of all cultural content in the world. There's no doubt at all. Largely because of internet. There is this writer called Harold Bloom. I was listening to a discussion that if you have been educated and come into internet is very helpful. But if you've been educated by the internet, it's a very bad thing. Okay. So the question is that you have the point is that most people today are educated by the internet, right? That's a serious problem, right? And there's nothing you can do about it. It's a technological development you can't wish away at all. That's the thing, right?
So if I may, I'd like to add some context into this from people who are constantly working day in, day out on scripts. There is definitely a possibility for collaborations between experts and writers or filmmakers in general. And I think that has to be a very intentional decision that is made very early on. And for example, just yesterday, I can share context. There was Vanessa D'Souza from Sneha, who Civic Studios has worked with to gather a lot of research and insights with them based on their findings to shape our ideas as to what we wanted to create for a series of ours. So I think these are the early stages that we can integrate this into, and a lot of Western cinema has already been successful in doing so, but we are at a much more limited capacity when we're doing it in Indian cinema. But there is, of course, a lot of room to explore this.
Just to add on, I mean, I agree with what she's saying. Essentially, experts and it's if you want to make a war film, people get veterans to come and sit in the writer's room, right? It's very similar, and it's not inaccessible for people to get either people who have experience with what they're trying to do or experts who have the ability to diagnose and break down how it will be beneficial for the audience to understand this thing. Even at Pocket Aces, we have, obviously we have mental health as a core component of our values to maintain and balance your mental health. So we have in-house therapists and stuff like that. And we also, when we're doing series, we make sure that it's sensitivity training essentially happens so that anything that we're portraying is either clear and non-problematic or is representative to be able to get an outcome from it.
All right. That's the end of our session. Thank you so much for sharing your valuable points. I'd like to end by saying that one of the key highlights is our understanding that our journey forward should be of learning, empathy, and responsible storytelling, informed storytelling, an effort to make mental health narratives accessible to people of all backgrounds from all across the country. We should be advocating for narratives that not only entertain but also educate, inspire, and intentionally destigmatize when we portray it on screen. So thank you for everyone who joined us here today. We hope this conversation sparks more awareness and compassion in the films that you consume and how they impact your lives. Thank you again for coming by.